I'm going to talk to you guys about PANS and PANDAS and these kinds of chronic infections that we see in our children on the autism spectrum. And I think that our kids have so many different symptoms and they're always kind of changing, almost even day to day, that sometimes we might not recognize what is happening with them, and we may not recognize that they have an underlying infection. Is PANDAS, which stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with a Streptococcal Infection. So that's what that acronym stands for. And the term PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. And the key to both of these is that term acute, which means it happens suddenly. So when they first started talking about this post-streptococcal infection, or PANDAS, they just had that group. And then they expanded that group to add other infectious triggers. And so they called that PITANS, or Pediatric Infection Triggered Autoimmune Neuropsychiatric Disorder. And they added other infections to the diagnosis. So in addition to strep, they added other diagnoses or other infections like Mycoplasma pneumoniae, Lyme disease, Chlamydia pneumoniae, other potential viruses like varicella zoster, which is chickenpox, and influenza, the flu. These could be potential triggers for PITANS. And now they've expanded the diagnosis even further, and they call a wider potential array of triggers, they call that PANS. So it's possible that allergens can also trigger them. And it's possible that other metabolic factors, potential toxins in the environment, an acute episode of a toxin exposure. And then the other potential possibility is an acute severe stressor. So a major stressor in their life could potentially also trigger this kind of immune activity in the brain. So I said there's these infectious triggers. The infection is not causing most of the problem here. What's causing most of the problem is the way the immune system handles that infection. And instead of just killing the infection and getting rid of it, they end up fighting the infection and they produce antibodies to that infection. But those antibodies get confused with other body tissue and start fighting itself. And that term is called autoimmunity. So other autoimmune conditions are disorders such as lupus, Graves' disease, or Hashimoto's thyroiditis that causes hypothyroidism. Type 1 diabetes is one as well. And what we find in these patients is that if they have these frequent episodes of PANDAS and frequent infections and ongoing infections, this disorder may become chronic instead of up and down. And the term for that would be autoimmune encephalopathy. So again, the general symptoms are this OCD. 25% of the kids have tics. Some kids have this need for symmetry where they'll rearrange the furniture or rearrange things on their dresser or in the house. Some kids have a fear of contamination where they don't want to touch things, they don't want to be touched, they want to wash their hands very frequently or their body. Some of the kids have body image distortion. That's where they might see themselves as being fat when they're not fat. Suicidal tendencies and depression can also occur. So other symptoms that are associated with PANS include emotional liability or depression, irritability, aggression, oppositional behaviors. I think the key for me, when I talk to parents is this history of a regression. You guys tell me that your child often regressed into autism between 15 months of age and 20 months of age. Something happened. The same thing happens with this disorder. Parents will tell me, all of a sudden my child regressed. So any change or any regression in their behavior or their symptoms, we need to think about PANS or PANDAS. Any deterioration in school performance, and any sudden onset of tics. There are some other symptoms that are also associated. Change in handwriting is a big one. So if you have handwriting samples before and after, they can even be used for diagnosis. Change in sleep patterns, and a big one for us is enuresis, which means wetting the bed or having urinary accidents after they have been potty trained, and then frequency of urination. So there is a diagnostic criteria for diagnosing PANS. So the absolute criteria is the sudden onset and sudden change or regression of symptoms over a period of 2 to 6 weeks. It doesn't occur right away. The major criteria is, again, OCD, anxiety, and anorexia. And the minor criteria are some of these other symptoms that I mentioned. So for a diagnosis, you need patients with that acute onset, and they must meet the absolute criteria and 2 major criteria. If it's hard to see that acute lightning onset, you can meet the criteria by having 2 major criteria and 3 minor criteria. So again, if you look at some of these criteria and the history, that's how we make the diagnosis. So most of the symptoms that occur, as I mentioned, the main major criteria symptoms are OCD, anxiety, and anorexia. But some of these other symptoms are quite prevalent. 98% with separation anxiety, 90% with handwriting deterioration, 80% with this hyper alertness where they can't sleep. Those are quite common, and 70% with tics. Almost 20% of these kids have an abnormal EEG. So that might be something to take a look at as well. If they can draw clocks, oftentimes they will not draw the left side of the clock. Even the left side of the body, they have a hard time using. And so for some reason, in some of the kids, it almost looks like they had a stroke. In terms of traditional approaches, take a look at a website called the Pandas Physicians Network. And the Pandas Physicians Network talks about how you treat pandas, but again, from more of a traditional approach. So number 1, we treat the source of an infection. So if we find the infection and we find the trigger, we want to treat it with antibiotics and antivirals. And the rule of thumb here for antibiotics now is about 1 month. For symptom relief, we want to make patients comfortable. So we want to work on treating their mood and anxiety symptoms. And often these patients do well with something called cognitive behavioral therapy. Number 3, we want to work on the immune system because this is an autoimmune condition. So in the traditional sense, they would try a trial of steroids to decrease the brain inflammation. we might need to consider high-dose intravenous gamma globulin to bring down the autoimmunity. And in severe cases, plasmapheresis, basically taking the plasma, the blood, running it through a filter and clearing these antibodies can be used. However, we're here to learn about integrative medicine. We're here to learn about complementary approaches to dealing with this disorder. So I'm just going to share with you guys my approach, my integrative approach to pandas. So what we would use is things like probiotics to help modulate the gut. Just be careful with the kids with autoimmunity. They don't always do well with numerous strains of probiotics. So in this population, I stick with 1 or 2 very safe lactobacillus strains like Lactobacillus rhamnosus or Lactobacillus GG, and maybe bifidobacteria. Now, there is some research to show that helminthic therapy or good parasites can help with autoimmunity, and good parasites can be purchased and help to modulate the immune system in the gut. Xylitol is really simple, really safe to use. It's a non-absorbable sugar, and it kills strep. There are some antibacterial herbs that have anti-streptococcal properties, and herbs such as golden seal, berberine, neem can be used to help kill strep. And I also like enzymes that kind of break down that biofilm that the strep is hiding under and other infections might be hiding under. These biofilms protect the infections from the immune system and can be used to kind of break down that wall. So I use various biofilm protocols as well. Then we have immune modulators. For me, the main immune modulators are vitamin D and zinc. However, I oftentimes use vitamin A as well in this population, and vitamin C. There are therapies like immunotherapy that have been discussed. So again, this is an autoimmune condition where the body's fighting something it shouldn't fight. What if we tried to desensitize the body's reaction to these infections? So what if we treated it like an allergy? So instead of trying to desensitize against dust or mold or tree pollen, we could desensitize against strep. So that immunotherapy against strep is called low-dose immunotherapy, or LDI. Another potential nutrient, or actually medication, that we can use to modulate the immune system is called low-dose naltrexone. Now, naltrexone is an anti-opiate, and it's used for drug withdrawal. However, in low doses, it can be used for immune modulation. So that's why we call it low-dose naltrexone, not just naltrexone. The other things that I find helpful in working on in this population is adrenals. They're very, very stressed. When they get these infections, they're scared too because something just happened to their body they don't recognize, and they're not able to control their behaviors. And so giving adrenal support, working on things to calm down cortisol like phosphatidylserine, ashwagandha might be helpful. Chinese skullcap can be very helpful to kind of calm down the adrenals. Also, as I mentioned before, histamines are a big issue with this population. You could feed your child a high histamine food, for instance, like bananas, and they would get red cheeks or red ears. Or you fed them fermented foods like kombucha or vinegar, and they had a histaminic reaction, like you'd see some redness around their neck or cheeks. That, again, is not an allergy, but it is a histamine intolerance. When my patients flare with pandas, I give them a 7 to 10 day course of ibuprofen, a 7 to 10 day course of an antihistamine, and a 2-day course of vitamin A, just to calm down their immune system. I also like to use various homeopathics for inflammation, like arnica, apis, and histaminum. And there are some essential oils that can be used for strep and infections, such as thyme and oregano, eucalyptus, are some oils that can be helpful. This is information. This slide is information regarding helminthic therapy. Dr. Bill Parker, if you want to read more, he's from Duke University, and he talks about not just the microbiome, but the whole entire biome. And he includes good parasites in that concept of biome and biome restoration and reconstitution. Okay, so let's talk a little bit more about treatment. We want to have a holistic approach to this. We don't want to add more garbage to an immune system that's taxed. So we need to work on cleaning up the environment. And I know a lot of the speakers probably spoke to this, but I just can't tell you how important that is. Fluoride-free toothpaste, aluminum-free cleaning, aluminum-free baking powder, aluminum-free deodorant. Don't cook in aluminum foil. Don't drink out of aluminum cans. Those are some big ones. I also think, with this population, we're worried about that blood-brain barrier. So shut off your router at night. Don't put electronics in the bedroom. Don't let your children hold their electronic items close to their head, and keep them away from their body as much as possible. We also want to work at the diet, dairy-free, gluten-free diet. We want to maximize anti-inflammatory rich foods like antioxidants and phytonutrients and really good fats. And then really, really try to avoid excitotoxins. Things like NutraSweet or aspartate, red and yellow food dyes, nitrites, sulfites, foods that are high in glutamates, propionates, benzoates. And take a look at the fail-safe diet. These are the high amine foods, the high histamine foods, and fermented foods. So again, when we're talking about glutamate, glutamate isn't just MSG or monosodium glutamate. It can be in foods with hidden names like hydrolyzed protein or modified food starch. Even the word natural flavors can potentially be glutamate. So overdoing too much protein can add to the glutamate load, especially red meat. What we can use to nutrient that modulates glutamate is magnesium. Another big one is B6 in the form of P5P and lithium. So those three are big glutamate receptor and modulators or antagonists. Other nutrients that can be helpful for downregulating glutamate would be things like L-theanine, luteolin, quercetin, pycnogenol, and then vitamin D3 and K2 I like to help modulate calcium. Herbs that are very calming, rosemary, chamomile, lemon balm, skullcap. So the other step after cleaning up the diet is cleaning up the gut, getting rid of the bad bacteria, the dysbiosis, getting rid of the SIBO. But yeah, we need to make sure that we treat the underlying infections in the gut as well. So if we have Clostridia, if we have yeast overgrowth, strep in the gut, viruses, parasites can potentially aggravate the immune system and cause more leaky gut, leaky blood-brain barrier. So using natural anti-inflammatory agents, as I mentioned, can be helpful. And here's a list of some of these. Omega-3s are very good for inflammation. So just optimizing omega-3 doses to maybe 2,000 milligrams of omega-3 in children can be helpful. Using bioflavonoids that have anti-inflammatory effects, such as curcumin, pycnogenol, quercetin. Luteolin is in that list as well. And then there's some herbs that are natural anti-inflammatories. One of my favorite is myrrh or boswellia, stinging nettles. Licorice can be used, as well as Japanese knotweed and resveratrol. There are also substances called NRF2 inducers. And so substances such as sulforaphane or broccoli sprout extract, triphala, which is an Ayurvedic herb, and diindolylmethane or DIM. So what I like to do with herbs is I like to pulse them and rotate them. So I often use herbs like 5 days on and 2 days off, and I'll rotate them. So sometimes I'll try sulforaphane, or sometimes I'll try dim, and then switch it to triphala. The other thing we can do to calm down inflammation in the brain is increase a neurotransmitter in the brain called acetylcholine. Increase choline to help with calming in the children. So we would give things like phosphatidylcholine or phosphatidylserine, or even drugs that increase choline, like galantamine or piracetam. So I'm going to give you guys an example of one of my patients. So the history is that she had a regression at age 6 months, and she had a history of frequent infections and fevers. And then by the age of 2, she was diagnosed with autism. She had a GI scope that showed severe colitis. And by age 6, she had IVIG with no improvement, casein-free, gluten-free diet with mild improvement. She did some chelation. She used antiviral drugs, and she used to get better with antibiotics. And HBOT gave her some minimal improvement, but she couldn't sustain it. And no improvement with chelation. Oh, I don't know why I said that twice. So then when I saw her, she had single words, she had a lot of verbal stimming, she had scripting and anxiety, and a lot of mouthing and OCD. And her ATAC was around 64. So the parents had tried a lot of things, and still at the age of 10, she wasn't doing so great. So I started her on a biofilm protocol. I always like to treat the gut first. I used biofilm defense and some oral disodium EDTA. I used some antibiotics initially and then follow them with a rotation of herbs such as grapefruit seed extract, berberine complex, and wormwood for the parasites. And then I like to use a binder when I'm killing bugs. I use citrus pectin and charcoal. The intramuscular penicillin, because we bypassed her gut, gave her major improvements in her OCD, anxiety, and her language. She went from words to sentences in her language, and she became much calmer. Olive leaf extract really helped her a lot as well. And when we added natural anti-inflammatory agents and homeopathics for inflammation, it helped her further with calming and OCD. So thank you very much, and I'll open it up for Q&A.
Thank you so much.